Hi, I'm Luciano Costa. I'm an associate professor of medicine at the University of Alabama at Birmingham, UAB Comprehensive Cancer Center. I'm here at the American Society of Hematology annual meeting, where I had the privilege of presenting in behalf of my colleagues from many other institutions, a combination of Venetoclax, Carfilzomib, and Dexamethasone in patients with relapsed refractory multiple myeloma. So Venetoclax is this relatively new agent in hematological malignancies. It works as a very powerful BCL2 inhibitor. BCL2 is one of the molecules of the antiapoptotic family, along with BCL-XL and along with MCL1, that helps the plasma cells in myeloma to resist the injuries that will lead to apoptosis, including insult from anti-myeloma drugs. We know that when we combine Venetoclax with a proteasome inhibitor that was seen before with bortezomib and in our study with Carfilzomib, we minimize the reliance of the plasma cells on the other anti-apoptotic proteins, particularly MCL1 and BCL-XL, and increases its reliance on BCL2, therefore making Venetoclax even more relevant. So in this trial, we had 42 patients. We had 4 cohorts testing the optimal dose and schedule across 2 different dose levels of Venetoclax, 400 milligrams and 800 milligrams a day, and essentially 3 schedules of Carfilzomib, the twice a week low dose, twice a week high dose, and the once a week 70 milligrams per square meter. It's important to keep in mind that different from what has been done in other hematological malignancies, particularly CLL, there was no ramp-up dose. That means the dose of Venetoclax from day 1 of the first cycle was already the intended dose, either 400 or 800 milligrams. We had no dose-limiting toxicity on any of the 4 cohorts, and mostly inspired by the results of the Champion-1 study, and later by the results of the Arrow study, the decision was made to expand the arm with 70 milligrams once a week of Carfilzomib. Across the study, the 42 patients, we saw an overall response rate of 79%, and with about a third of the patients obtaining a complete remission. The combination has been well tolerated. Most of the adverse events has been grade 1 and grade 2, mostly cytopenias and GI toxicity. We fortunately have very few severe adverse events, mostly along the lines of pneumonia or other respiratory infections. And we had 1 episode of tumor lysis syndrome that was managed properly, and the patient continued therapy with full doses and went on to obtain a deep remission. What we found interesting is, even though the response was the highest and deepest among the few patients with 11-14, there were 8 patients, we also saw 73% response rate among the non-11-14 patients. The study is ongoing. The median follow-up is 8 months of the patients that we presented today. The majority of patients, 62%, remain on study, on therapy. The remaining patients have discontinued for a variety of reasons, including progression or patient or physician decision. Because we found those results quite encouraging, the study is being expanded now with an additional 60 patients being enrolled in the subsequent months.